So Miss Ali is a 52-year-old Caucasian female physician, and she was first noted to have elevated thyroid function tests in Canada around the age of 35, not treated for unclear reasons. She was then evaluated at UCLA OBGYN 2 years later for menstrual cycle irregularities, which were attributed to endometriosis. At that time, she was treated with Lupron and Zoladex. And she did note that when she was treated with these medications, she experienced some tachycardia and diaphoresis. She was then evaluated by endocrinology the following year, and her complaints at that time included hypertension, tachycardia, anxiety and shakiness, insomnia, loose bowels 4 to 5 times a day, and she was noted at that time to have a little bit of exophthalmos but no lid lag. So her labs at the time of that earlier evaluation from 1996 and 1997, some of the pertinent things that you can see there are highlighted in red. The total T3 is somewhat elevated in both years. The free T3 index is also somewhat elevated in both years. Total T4 is also significantly elevated in both of those years. TSH always remains within the normal limits. Additionally, there's another free T3 down there at the bottom from 1997, which is elevated. An alpha subunit is on the upper limits of normal. Her thyroglobulin antibodies at that time were noted to be negative. So thyroglobulin antibodies were negative, thyroid stimulating immunoglobulins were negative, and thyroid peroxidase autoantibodies were negative. Given that she had somewhat of a confusing clinical picture, she actually underwent an I-123 uptake and scan, which was within normal limits. And the assessment at that time was a transient episode of thyrotoxicosis, maybe related to subacute thyroiditis. She then moved to San Diego, where she established insurance at Kaiser. And she continued to have these same symptoms of diaphoresis, tachycardia, anxiety. And they even, apparently per the patient, performed a pheochromocytoma evaluation, which was noted to be negative. A little later that year, she actually underwent MRI of the pituitary gland, which revealed a small 5-millimeter pituitary lesion. She was followed with serial MRIs, and the tumor was noted to be growing, albeit slowly, over several years. She was then reevaluated at UCLA in 2010 at the UCLA Pituitary Tumor Program. And in between, the last time we had seen her, notably she had 2 children. She actually had a hysterectomy, which pathologic diagnosis noted adenomyomatosis. And she was actually treated at that time for the tachycardia, for the hypertension, and somewhat for these feelings of anxiety with atenolol and diazyme. Pertinent positives from physical exam: her heart rate was 61 and her blood pressure was well controlled on atenolol and on her diazyme. In general, she was somewhat anxious, she was very animated, and she did indeed have some mild exophthalmos. The thyroid gland was noted to be slightly enlarged, but did not have any discrete nodules. And on neuroexam, she was slightly tremulous and had some brisk reflexes. Then in October of 2010, TSH is 3.6, still within the normal limits. Free T3 is noted to be within normal limits, but at the upper range at 399, and the free T4 is elevated at 2.1. ACTH was 10, cortisol was 3 at 3 p.m., prolactin was normal at 15.